And Richelle Gregory is the Clinton County Director of Community Services. So nice to have you. Welcome.
Thank you so much.
We appreciate you being here. We mentioned the warnings from the U.S. Surgeon General, calling kids' mental health the defining public health crisis of our time. Do you agree with him?
I absolutely agree. And we have never seen such numbers and as young as we're seeing with the presentations to the community of kids with anxiety, depression, self-harm, and suicidality.
And we were seeing these trends long before COVID? They've
Yes.
really been developing over the past decade or longer?
Absolutely. So we were following some of those numbers before COVID, and we actually looked back and looked at the data, and we saw an increase in youth suffering from some of the diagnosis that I mentioned, and it was happening younger and younger and younger. And then with the pandemic, it exacerbated the whole situation, and we saw a steep incline in mental health and behavioral health issues for youth.
And you mentioned that the pandemic was so disruptive for
Yes.
so many, and it made it even worse.
Yes, well, you think of the social interruption, the family units, kids that struggle in their home environment, families struggling with addiction and mental health, and then kids being exposed to that on top of their own issues with not socializing, not having a routine, or even something as simple as the meals that were provided at schools.
The anxiety, the sadness, the depression, are there numerous causes?
Yeah, so it becomes a mixing pot and a storm in and of itself. So we deal with adverse childhood experiences. So that's, abandonment of a parent, substance use, domestic violence, mental health issues in the home. And then when you take out routine and structure and social supports from that, right, it exacerbates and it just highlights and makes the situations worse for youth.
The CDC Youth Risk Behavior Survey that we mentioned raised a lot of eyebrows this year. Two stats in particular, that 3 in 5 teenage girls, now this was 2021, just as we're coming out of the pandemic, 3 in 5 girls say that they felt persistent and profound sadness, a 60% increase over the past decade. And then the other stat that really jumped out, that nearly 30% of teenage girls who took part in that survey say they seriously considered suicide, 3 in 10. And the 10% actually attempted suicide. Mm-hmm. Have we ever seen numbers this high before?
We've never seen numbers this high, and I think that also a contributing factor is the exposure to social media. So maybe not normalizing it, but it's out there more than it ever has been.
As you and other mental health professionals hear these stats, you see these numbers, how do you react? How do you respond?
Yeah, so as the local government unit, along with the Community Services Board, we are tasked with the supervision and supporting services for vulnerable populations, which would include mental health, addictions, and developmental disabilities. So we report to the state on our gaps, needs, priorities, and goals for our community, which drives some of the initiatives moving forward to tackle some of these problems. So we have several great initiatives coming out that will support our system and support youth and families in our community.
What are some of the new initiatives?
So we developed a Systems of Care. So Systems of Care is a national program that really looks at pulling all agencies together and all youth-serving agencies together to be innovative and creative in serving the highest needs families. So we have chosen children that present the ER, mental health units with suicidality, recognizing the data around that, and we bring those youth that encounter barriers and families that encounter barriers in our system to access, and we discuss them and come up with a plan of care. That's just one. So other things include we will be setting up with Champlain Valley Family Center Intensive Crisis Stabilization, which is a 24/7 crisis center that will provide triage, mental health, medication, services in one place to divert from the emergency room and provide the appropriate care and access at the appropriate time.
And will that be right here in Plattsburgh?
It will be right here in Plattsburgh, yeah.
And on the drawing board or close to
Close
moving
to.
forward?
Very close to, so hopefully early next year.
A real need for that? Is the emergency room not the right place for people with mental health challenges to go?
Absolutely. So the emergency room, right, is wonderful service in our community. However, behavioral health populations often get stuck in the emergency room because we either don't have the community services to support appropriately what their needs are, or we lack state resources so for them to continue somewhere else that may be a more long-term stabilization. So we're hoping to intervene sooner, appropriately, and provide the right access for individuals struggling before we reach, emergency room level care.
Crisis intervention, any new programs or initiatives there, either with the schools or with police departments?
Yeah, so Behavioral Health Service North runs our crisis intervention team, or mobile crisis team, I should say, and they've been in our community for a few years now and doing really good work. We also started the crisis intervention team, which is a partnership with law enforcement to train law enforcement officers on de-escalating emotional crisis in our community, behavioral health crisis in our community, to work hand in hand with the behavioral health agencies in our community.
Burlington is one, and a number of communities now have mental health crisis intervention people who go out on calls with the police department. Is that something we may be considering in this area as well?
Absolutely. So that's an option. We just are in the process of developing protocols that will work for our community and building those relationships and training.
When we heard these CDC stats, when the survey came out for this year, New York's Governor Kathy Hochul immediately organized a listening tour across the state and then held a youth mental health summit back in June. Is the state helping out? Is the state either offering new initiatives or funding to help communities deal with this?
Absolutely. So the governor has dedicated $1 billion into the mental hygiene system. So OMH more than ever has been strong in supporting and working with local government units to identify the needs that are really community specific. The people in my position in local government unit understand the needs of our community and what resources we have to tackle the problem, and that wouldn't be the same as New York City, or it wouldn't be the same as Albany.
And so for parents, if parents are concerned, where do they turn? Here in Clinton County and here in the North Country?
Yeah, so part of our systems of care work was identifying a resource for families and the community that really provided information and resources that were local. So Systems of Care developed a website, caringfornorthcountrykids.org, and on that website it's all of Clinton County resources for youth. So it has basically a search bar. You write what you're struggling with, and it'll show agencies on that webpage that will be able to help you.
Richelle Gregory, thank you so much for taking the time to be with us. We so appreciate it.
Thank you so very much, and I appreciate you getting this out to the public.